This is fantastic news. This is fantastic news for the state of California and the nation. We have another tool in our arsenal against COVID-19, and I'm thrilled that we have a one-shot vaccine. Well, I mean, here in California, we've been working incredibly hard to vaccinate as many Californians as quickly as possible. I think that this vaccine only adds to our supply, which I think is critically important. And in addition to that, we also recognize that there are some communities, we have such a diverse population, there's some communities that have a harder time coming back in for a second shot, right? So some for whom doing a 2-dose regimen is more difficult. And so now we have another option for those folks. Oh, we're talking about, for example, homebound individuals, right? We recognize that individuals who have severe disabilities or pre-existing conditions that make it really hard for them to leave the house, now they can have a 1-dose vaccine instead of having to try to do it 2 times, right? For example, we have a fair number of migrant individuals in our agricultural communities. So for example, farm workers, where folks may be here in one place for one vaccine, but may have a very, very difficult time, following up. They may be in a different location for the second vaccine. And so a 1-dose vaccine might be easier for folks to be fully vaccinated. Yeah, I mean, so interestingly, I think the big thing that distinguishes the J&J vaccine is that it's just 1 dose, right? But beyond that, we know it's safe. We know that it's effective. We see that the side effects are generally very similar to the Moderna and the Pfizer vaccines. So from that standpoint, there are a lot of similarities in terms of the experience of getting the vaccine. There are some differences in the science, how they made the vaccine. The Moderna and Pfizer are mRNA vaccines. This vaccine is actually created from an inactive or weakened version of the adenovirus vaccine. And so this is a adenovirally vectored vaccine. So there's some of the fancy science that I get really interested in behind the vaccine is different, but really in terms of the safety and the efficacy, it's very similar.
And the fact that it doesn't need to be refrigerated is pretty remarkable, right?
That is actually, yes, a big deal. So the fact that it doesn't have to be in the deep freeze, it is stable at regular refrigeration temperatures, also just makes transporting the vaccine, storing the vaccine, getting the vaccine out and distributing it a much easier process. So what the studies show is that this vaccine is 85% effective against severe COVID disease, which is a very, very high rate of effectiveness. Now we see with the Moderna and the Pfizer that they're slightly higher, but in terms of when we're talking about protection from severe disease, we see this is an excellent vaccine. When we're talking about protection from death, we're seeing 100% protection. And so that's really critical. Another thing about this vaccine that is really important is that this vaccine was tested both in the United States and then also in South Africa. And as we are tracking the emergence of different variants, one of the things that's exciting is the likelihood that this vaccine has efficacy against some of those variants that we're concerned about. So what we'll see in California, and we're still learning because the federal government is still kind of sharing their plans about how they're going to roll this out. But what we can expect is that the J&J vaccine will be added to our supplies of vaccine. Now, the way that it works right now is, for example, in many of our vaccine sites, right, a site has one type of vaccine, and that's because of the storage requirements and the transportation requirements and all those things. So likely we'll see a similar thing where some sites will have J&J, some sites will have Moderna, some sites will have Pfizer. And because the Johnson & Johnson vaccine is more fridge stable, and because it's because it's only one dose, we'll likely be able to have much more flexibility in our use of that vaccine. The number one takeaway on the Johnson & Johnson vaccine is that it's safe, it's effective, and it's just one shot. So, all of these, we think that's incredibly positive, and it's a very important tool in our arsenal against COVID-19. Oh, I wish I had the answer to that question. So, you're absolutely right. I think we've heard different things about how much vaccine that we are going to get, or that we're promised to get, and we're excited about the idea of the federal government ramping up vaccine supply. In the state of California, the Department of Public Health, we essentially don't count our vaccines until they arrive, simply because, or until we know that they're shipped, simply because some of those numbers do go up and down. But what we are hearing from the federal government is that there is a plan that we will have increasing numbers of doses of vaccine in the coming, weeks to months. So that's a great question. So the way that our allocation system goes right now is that phase 1B still, if folks remember, is kind of a combination between an age and sector based. So we have those who are 65 and up, then from the age-based framework, and then we also have educators, farm workers, food and ag workers, emergency responders in that sector-based strategy. And you're absolutely right, those with pre-existing health conditions and certain disabilities will be next. They will have access starting on March 15th. I also want for folks to recognize that all of this is pending vaccine availability. So there are lots of people who are still gonna have to wait to get access to vaccine. But then following that, we're switching to an age-based system. And that age-based system is really going to be going down from age 65.